breast reduction, or a reduction mammoplasty, which is also another term for it, is a procedure that's carried out on ladies who have a condition called macromastia, or large breasts. There are really no defined size where a lady will benefit from a breast reduction, but most of the ladies that come to see me often complain that the size of the breasts is interfering with clothing. They find that particularly wearing or finding a bra is difficult, A, in terms of size, but also B, as their bra straps tend to dig into their shoulders. They tend to find clothing is also difficult because they may be slim, but the size of the breast is out of proportion to the rest of their body. And they also have other physical symptoms in terms of inability to be able to exercise. The procedure itself is carried out under general anaesthetic. It takes around 2.5 to 3 hours, and most of the patients tend to go home the same day. In terms of recovery from a breast reduction, I use very, very light dressings, and we have developed a particular technique where we stitch and glue and tape the wounds, and that means that most of the patients will be able to shower the day after the surgery, and the dressings are then removed at 2 weeks, and at that point most of the time the wounds have completely healed. The patients are then required to wear a sports bra for a further 4 weeks. After that, they go and get measured for a new bra. So there are lots of operations that are available in order to reduce the size of the breasts. After a full history and examination, I will be able to advise you in terms of which procedure is most suitable. From the simplest end of the spectrum, the operation can involve liposuction. We tend to use these in ladies who don't need the breast position changing and who need small decreases in breast volume. This operation is also good in ladies who have a tendency to form bad scars. Most patients require a formal breast reduction, which involves an anchor-shaped scar. The real advantage of this technique is that, as well as actually reducing the size of the breast, it can also combine that with an uplift. The position of the nipple can be decided between myself and the patient can look as young as 21, 25 or over 25, depending on what they're hoping to achieve. Most of the operations require a general anaesthetic, and most of the patients have the procedure carried out as a day case, so that they can leave the hospital the same day. So there are lots of benefits to having a breast reduction carried out, and I generally tend to think of these as physical and psychological. In terms of physical, the most obvious benefit is to have the size of the breast reduce. I generally tend to agree with the patient prior to having the surgery in terms of which size they roughly like to be after the procedure. Most patients find that actually having large breasts has interfered with the clothing and exercise, and reducing the size of the breasts allows them to actually wear normal clothes and to be able to do things like going to the gym. Other major advantage of having a breast reduction is that often, because of the weight of the breast, the shape of the breast is not very attractive. And so by having a breast reduction, a much more pleasing shape can be achieved. That shape is also important because most of the bras that are made for a globular shaped breast, and by achieving that with a breast reduction procedure, patients then find that it's much easier to find bras that fit them. In terms of psychological benefit, the social stigma is often removed, and people find it's much easier when they tend to interact socially. And lastly, the other benefit, which is often unrecognised, is that breast reduction can also reduce the risk of cancer. We sometimes carry out these procedures in order to remove the breast tissue, and this actually reduces the chance of developing cancer as there's less breast tissue available. Well, actually there are very few don'ts after this procedure. Most of the patients that are having a consultation for a breast reduction or considering a breast reduction are often worried about severe pain after surgery. In fact, the procedure is very well tolerated, And as explained earlier, most patients have the procedure carried out as a day case. In terms of do's, we generally tend to advise patients immediately after surgery to take some relatively light painkillers and to wear a sports bra for 6 weeks after surgery. You can come out of the sports bra after 6 weeks and then go and get measured for a new bra, which will usually be the patient's stable size after that. In terms of don'ts, again, we have very few don'ts. And in general, the dressings are very, very light. I've developed a technique which involves stitches, glue, and a very, very light tape. And that means that essentially patients will be able to shower straight away. We generally tend to recommend not to do any heavy lifting or exercise for 2 weeks after surgery. And once I reduce the dressings and we can then have a look to see how the wounds are coming along, I tend to advise patients in terms of going back to things like gym work or heavy manual lifting. Swelling and bruising are common things that patients worry about having after having a breast reduction. In fact, both swelling and bruising are relatively rare after this form of surgery. There are lots of steps to be taken to avoid bruising and swelling after a breast reduction operation. First of all, during the operation, we tend to infiltrate the area with a local anaesthetic that has adrenaline in there, and that essentially reduces the bleeding post-operatively and means that patients can have a very, very light dressing after the surgery. We tend to place my patients in a sports bra immediately after surgery, and again, we tend to find this tends to help the swelling and bruising afterwards. Patients are often then given good pain relief immediately after the surgery, and this reduces the chance of coughing and pain afterwards, and this again helps to stop swelling developing after the surgery. In general, there will be some swelling within the first 6 weeks, which is why we advise patients not to go and get measured for a normal bra until that period has gone. After 6 weeks, most of the swelling has then fully settled down, and that means that they can get measured for a new bra at that point.